then there was no impact on fracture. So is there any role for vitamin D in fractures? Well, there might be. There's a great study by Chapuis and colleagues published 30 years ago in New England Journal, in which they took nursing home patients, 1,600 randomized to calcium and vitamin D and 1,600 to placebo. Never to be done again. Nobody would ever do a placebo-controlled trial, especially in this vulnerable population. And they found a 33% reduction in hip fracture risk in the calcium and vitamin D group. Why did they do that? Why did that happen when you don't see any other data to suggest that? And the reason for that is because these were vitamin D deficient individuals. The placebo group started at 13, the vitamin D group started at 16, and you can see that they had this major difference with only 800 units of vitamin D. At 6 months, they went up to 40, and then at 12 months, 42. So they were able to replete their 25D, and they were able to suppress their PTH, which to me is very suggestive that in some elderly populations, particularly those that are not exposed to sunlight, prior to the time that vitamin D and calcium were supplemented in people's diets, that this had an impact. And we now know that there probably is early signs of aging and accelerated aging in those individuals that have very low levels of vitamin D. And there's an increase in cortical porosity and microcracks. So, quick review, vitamin D supplementation in chronic diseases. There's no evidence currently that any of these diseases have been shown to be affected by vitamin D supplementation, and that includes COVID-19, both acute and long-term, long COVID. And these are the supplementation studies, and there are a number of them, and none of them have proven, despite large numbers, that there's any impact on chronic disease. One of the ones that we had hoped would show something is with falls. And that is that if you gave enough vitamin D, you could prevent falls by strengthening muscle. And that proved to be not the case in the STURDY trial, which was one in which I was the chair of the Data Safety Monitoring Board. And in fact, not only was not the case, but we had to stop the study early because there were greater morbidity outcomes in the higher dose vitamin D, 4,000 unit group. And it turned out that 200 units a day was the best dose. And I'm sorry, but just to remind you, these were individuals recruited with frail elders, and they all had to have less than 30 nanograms per ml of vitamin D. So the overall conclusion from STURDY is that even among frail elders now, with low levels of 25-hydroxy-D, vitamin D did not prevent falls. So one of the common things that people talk about is vitamin D. We don't give enough of it. Maybe if you give more, you would have a more positive effect. Is there any evidence to support that? Well, Carrie Sanders did a great study in JAMA in which she took frail elders, mean age 76. A third of them had fractures. They all had serum 25D levels of about 20 nanograms per ml. And in those individuals, when they were treated with high dose vitamin D, so they were given 500,000 units once a year, they increased their vitamin D level to 90 nanomoles per liter early in the course within 1 month. It's given once a year, and then it goes up again. But they were unable to show that this reduced fractures. And in fact, falls were greater and fractures were tended to be greater. And this has been confirmed in other studies, including STURDY, that suggests that high-dose vitamin D given as a single bolus dose is not only not effective, but potentially harmful. So, conclusions, the main action of vitamin D is to promote calcium absorption in the gut. Vitamin D insufficiency probably is a term that we shouldn't use anymore. The evidence that vitamin D reduces fractures with or without calcium is weak in the general population, maybe strongest in the elderly that have true deficiency. It does not prevent other diseases. I suspect we should not be screening individuals for vitamin D levels in routine primary care, but may be appropriate in patients at risk for vitamin D deficiency, such as GI diseases, inflammatory